This is Channel 2 News, coverage you can count on.
Good evening. Well, we've all heard the stories about the opioid epidemic here and, of course, across the country and how overdose deaths are spiking.
So the Nevada legislature has taken steps to help prevent opioid abuse, but some say that the new laws have some unintended consequences. Chris Buckley spoke to a woman who's been suffering with chronic pain for years. And Chris, this is someone who's been facing a lot of uncertainty these past few months.
A lot of uncertainty because of the new way these laws are written. There's been some debate in the medical community about how they can continue to treat those that rely on opioids to live their lives.
There's a big stigma, yeah.
Fernley resident Tina Smith has been living with chronic pain for years.
Stemming from multiple surgeries, degenerative disc disease, 4 levels fused, and a swan's neck deformity correction. So my neck looks like the Terminator neck in x-rays.
And all that pain was taking a toll.
My husband and I had to go to couples therapy. The chronic pain was destroying our marriage because the unfortunate side effect is that when you don't feel good, you have a tendency to take it out on the people closest to you.
She's been working with a pain management specialist. That involves signing a pain contract and says her opioid medication is the only way she makes it through the day.
The pain's too overwhelming, I can't function.
Last session, the Nevada legislature passed AB 474, aimed at curbing opioid abuse.
I realized that steps need to be taken, and that's wonderful. But what happened is that, first of all, I know other people who are on pain management, and we all agree that hearing about it, you kind of don't want to tell people, oh, yeah, I'm on pain medication, because you kind of get labeled a drug abuser when you're not. Secondly, for a while, the way the law was written, my doctor thought she and the rest in her practice were going to have to quit prescribing any kind of opioid pain medication to all of her clients once 365 days had passed.
That news came as a shock.
My life, as I know it, is going to end. I'm not going to be able to do anything.
So she reached out, talking to lawmakers, physicians, and others in the same situation. And finally, some good news. As of today, it looks like she'll be able to stay on her pain regimen.
I started shaking. I was so happy and so relieved. That was the future I was looking at, laying in my bed, not being able to do anything, not being able to interact with my family. And now I can keep trucking on.
Now, Smith says her doctor and others in the pain management field have been meeting with lawmakers to try to clarify the wording of AB 474 so there's no confusion when it comes to treating existing patients with these kinds of conditions, because there are big penalties for breaking these new laws, like disciplinary action or losing the ability to prescribe drugs. Covering the story live in the studio, Chris Buckley, Channel 2 News.